News Talk 96.1 and AM 1180 KERN.
Dr. Bridgebomby, we lost.
Yeah, Richard, I'm sorry. I'm in the backcountry in Utah, and I'm not sure if the connection is good enough or not. I picked a spot that was good, but I don't think it's working.
Okay, well, you sound good now, so good.
Okay, sounds good.
Okay, thank you for calling in. I appreciate it. I think you're on your vacation time. We were talking about the president's treatment of COVID, and I know that some, if not experimental drugs, some drugs that really hadn't been approved for public use yet. Could you explain walk through his treatment and talk about some of the drug cocktails he got? And are these therapeutics available to anybody?
So what he got is new and innovative medicine that's called monoclonal antibodies. This is genetically engineered and cleaner version of the convalescent plasma that has been administered for sick patients. And the monoclonal antibody stops the virus from latching on to the. So basically, the spike protein in the virus latches on to a receptor in the cell. The receptor is called ACE2, or angiotensin converting enzyme inhibitor 2 receptor. Once it latches onto the receptor, then the virus releases itself into the cell, takes over the cell completely, and starts replicating itself. Then the virus from that infected cell is spread to other cells. Basically, the line of defense is to stop the virus from latching on to the receptor. This antibody does that. So this is an incredible barrier between the virus and the cell. So if the cells are not infected, there won't be any damage to the cells, and there won't be downstream inflammatory response that causes the cytokine storm and all the consequences, including respiratory distress, things including thrombosis, clotting disorders, strokes, heart attacks. So the monoclonal antibody is a phenomenal medicine, but it hasn't been tested yet. Roughly 170 people have received it within the construct of trials. Okay. About 10 people have received on a compassionate use basis. So our president is the first to see the monoclonal antibodies, along with the remdesivir, the viral and which is anti-inflammatory. In addition, he received and zinc, and vitamin D and zinc have shown to have a favorable impact. We briefly mentioned last week, the study in Boston showed that people with low vitamin D tended to have adverse consequences and higher fatality. A study in Spain showed that people who had low zinc level, in Spain, had a higher mortality. But the best concoction available based on the current science and development. And as we were discussing as the Marine and the White House last week, we mentioned all these drugs, and at the time, President did look unwell.
Yeah.
But he has dramatically is on the way back on the.
Hey, you're fading out a little bit, Doc. You're fading out. Are you there? Hello? Did we lose him, Jay?
Yes.
All right, you're fading out. The last I heard, you were talking about that the low levels of zinc for some led to a higher mortality. Is that right?
That's right. So the people who had higher chances of death tended to have low level of zinc. So, thus, between vitamin D, zinc, monoclonal antibodies, remdesivir, and dexamethasone, he got the best conceivable combination or the cocktail of medications. And the proof is in the pudding. When we saw him climb the Marine One, he looked sick.
Yeah.
He responded dramatically and turned around within 48 hours. and he has been making progress, which is very great. It's an excellent news, but it also good news that the efforts that have been put in the pursuit of developing therapeutics are working.
Huh. Well, you were fading out a little bit there. Is this the first time that these different therapeutics have been combined in the way they have to treat COVID with the president?
This is the only case in the world.
Wow.
Our president is the only one who received those medications in combination. Nobody else has.
Okay, all right. And he looks so well now. There's a lot of talk since he was on some type of steroid. I believe even Nancy Pelosi thought that he is exhibiting behavior consistent with an altered state. She's implying that there's something in the drug mixture that has made him animated or altered. Is that a possibility?
So the steroids in high dosages can have a feeling of euphoria, and in some people that can even be psychosis. So they do impact the cognitive side, but the trajectory of his progress has only been ascendant. So if he had any side effects, he was temporarily euphoric. That I don't think that's there anymore. I think people do tend to overdiagnose and things like that. But it's hard for me to judge that there has been any significant cognitive impairment or anything close to psychosis.
He looks, Dr. Bama, the president looks really robust right now. In fact, he looks to me like if I didn't know he had been sick only a week earlier with COVID, I never would have guessed it. Now, there have been a lot of cases, and I believe British Prime Minister Boris Johnson was like that, where he started to recover and then he crashed again. Is that something that could happen to President Trump? Could he go a week or 2 weeks feeling okay and then relapse?
That's a tough question to answer. If he didn't have the monoclonal antibodies, the probability of that would have been higher. What the monoclonal antibodies do is they limit the amount of infection, and if the amount of infection is curtailed, then downstream consequences are contained. So I'm optimistic that he's going to follow that kind of a downturn. With Boris Johnson, if you remember, he was sick for a while. He acquired the virus, and he took about 2 weeks to go to the hospital, and he was in ICU for a few days. And after he was released, he took another couple of weeks to recover. And even now, in the United Kingdom, people worry that he has still some cognitive fog at times, and his energy level hasn't really come back to where it was. But the difference between Boris Johnson and our president is that Boris never got to get the concoction or the cocktail that President Trump got. So President Trump got a combination. So in my mind, that's a triumph of therapeutics. The therapeutics have progressed to a level where it can substantially alter the course of the disease in a favorable manner. And now this company, Regeneron, is going to emergency use authorization for monoclonal antibodies. They have about 50,000 dosages, and they will go 300,000 doses.
Okay, you cut out again. You said they had about 50,000 dosages?
And they're accelerating their ramping up their capacity to increase the availability. Another thing about the monoclonal antibodies is because U.S. government gave them $500 million for the development of the drug, it's going to be free for a foreseeable future.
Oh, well, that's good. That's good.
Yeah.
All right. Well, excellent. Very good. So, in fact, the president could have been, since he was the first one to receive this, kind of been the guinea pig for an effective therapeutic cocktail that could help a lot of people, correct?
That's correct. I would call him guinea pig, but I would say it's a compassionate use of a very promising agent.
Okay. All right. We got cut off again. You still there?
I said a lot of people have high hopes on the promise of this medicine, and I think it's delivered in case of this, President Trump.
Okay, all right. Final question, because you're cutting in and out. What are we to make of these cases in the U.S. that are increasing again? And we've heard a lot about we could have a very, very tough fall. We could have the twin-demic of both COVID and the flu. What should we expect for the fall? And what does your gut tell you?
You know, there has been a false dichotomy that either open or wear the mask. The mask, only the correct solution is to open with precautions. If we do that, if we maintain the distances, we should be able to combat the threat of confluence of flu and COVID come this winter. It's really our choice. If we exercise a choice in a reasonable manner, we should be able to excel, but people continue to trivialize and minimize the severity of the disease. If we do that and don't behave, the worst is ahead of us.
Yeah, it's in our hands. And I saw some news today about they had shut down the authorities in Madrid had shut down, this weekend had told people that we don't want you traveling to other provinces because there's an explosion of cases there. It just seems like all over the world, Dr. Bombi, that you have that societies and communities enjoy a degree of success, and then damn if it doesn't come right back.
It's the quarantine fatigue, it's the lockdown fatigue, and people's rebelliousness. But the virus has no such fatigue. It's relentless. And we have to be relentless in practicing precautions till the time vaccine is universally available. We have to be patient. The lack of patience is going to be expensive to healthcare as a whole. And as we previously mentioned, it's not only the COVID, it's non-COVID care that's adversely impacted, and the diseases that we can easily address, from cardiovascular diseases to infections to tuberculosis to HIV, all those negative ripple effects are adding on to the death burden. So please be careful. We keep on saying if you practice precautions, your sphere of life expands quite a bit.
Yeah, no kidding. Well, look, you are traveling. Is this the first time you have traveled, left Bakersfield since the pandemic?
I've been to Tahoe before.
And what was the air travel like, Dr. Bombi? Was it okay?
It was okay. Everybody has the masks on, so we don't talk and mind our own business.
All right.
So hopefully it's okay.
That's my kind of travel. Yeah. Okay. Well, look, have a great time. Be safe, and we'll talk to you when you get back, my friend.
I apologize for bad connection and rushed kind of a conversation, but we'll make up next time.
We'll make it up for it next time. Have a great time, Dr. Bombi. Appreciate it. Thank you, sir.
Appreciate it. Thank you very much.
All right.